everyone. So in this video I want to explain and talk about how to prepare and what to expect when you go in for your scheduled C-section. For those of you who are either scheduling your C-section or it turns out to be an emergency C-section or whatever the circumstance or case may be, I wish that there were more videos on this to help prepare myself when I had to do mine the first time. So I decided to go ahead and make one so that way I can at least put out my experience for those of you who want to know exactly what the heck goes on during the whole shebang, beginning, during, and after. So first of all, a little bit of history is that I was induced with my daughter, and the induction had failed after 4.5 days of being in labor, and it was not progressing any further, so we had to go in and do a C-section. And that is why I had mine. And obviously it was a good thing because we were 37 weeks and she was already weighing 9 pounds 10 ounces. I had a very large child in me. So what to expect when you go in for your C-section. You will go in and they will have you be in a room with your partner or whoever else you want to be with, because usually in the OR you are allowed to have one person by your side, whether it be your spouse, your friend, your partner, a parent, whoever that is your support system. And then you have a team of doctors. So you have so you have like the baby nurse, you have your nurse, you have the surgeon, you have the surgeon assistant, you have the anesthesiologist. You have a room full of people. So after you sign your paperwork and they explain to you who your anesthesiologist is, because usually this is the person who comes in to give your paperwork and tell you and prepare you exactly what is going to happen and everything else that goes on with it, pretty much signing your life away. It's not that scary, I promise. They'll have you undress and put a gown on and have only the gown, no underwear, no bra, nothing underneath, just the gown. And they will roll you into the OR already on the gurney, and they'll put you on the bed that kind of looks like a lethal injection bed because your arms are completely out to your sides, and that's what it reminds me of. Which I think was the most scary part of it, was that that's what it looked like. However, it's nothing like that, don't worry. And they have, in my case, I had the neonatal nurse who was coaching me. She was very sweet and very kind, and they have you sit up and you bend all the way over, hunched over a pillow, and the neonatal nurse is like in front of you, holding your arms and kind of helping you like bend all the way down so that way they could get to the space in between your spine that they need to get. And this is for your spinal block. So the first thing they give you is, is a numbing agent. And this feels like, I guess, like a bee sting, but not as intense as a bee sting. If you want to, describe the only pain you will probably experience up until baby is born, is this one little pinch. And then after they numb it up, the anesthesiologist will then insert a catheter into your spine, well, in between your actual spinal column, and they kind of help you guide, where it's going. So they go a little bit more to the left, you feel not a shooting pain, but more of just like a shooting sensation, I want to say, through your whole entire left side of your body. And that's when you say too far left, and if it goes too far to the right, obviously it's too far to the right, until they hit right in the middle and you don't feel a darn thing. And they ask you, do you feel that? And you say, you feel what? That's when they hit the right spot, and they insert the medication, and all of a sudden you start to feel your toes start to tingle a little bit, and they kind of go numb. And then they lay you down, and that's when the nurses will prop up your legs, and you will have a catheter, a urinary catheter inserted. And this is so you do not pee yourself and everything else you need a catheter for. And by this time, you are already laying down on your back, and your partner is not in there with you yet. Your body, I want to say from like your hips down, are pretty much completely numb. So even though they straighten out your legs and lay them flat, it kind of feels like your legs are still propped up, even though they're not. That's just how your legs were when they became fully numb. So that's how it feels, but they're completely straight. So after that, they have your partner come in and they have a drape in front of you, and your partner's there beside you, and you have a nice little support system. And then the next thing that happens is they touch you either with like something cold. I'm guessing it was one of the instruments or a tool of some sort. They touch you with something very cold on your stomach to see if you feel anything. And if you don't feel anything, then they begin. And I remember at this point, they cut you open, separate everything they need to do, snip, snip, cut, cut, baby's removed. And then they stitch you up, which takes the longest part is the actual stitching. After baby is born, it usually takes, I want to say, under 5 minutes for them to actually begin the process until your child is out. And then after that, 20 to 30 minutes of actually cleaning up and closing you up. So some people get staples, other people get dissolvable stitches, which I personally prefer. They are gone within a week, and it seems like it's less painful to deal with afterwards. So after baby's out and you're stitched up, they will roll you over, take the catheter out of your back, slide you onto a separate gurney, and take you into the recovery room for about 2 hours, where they monitor your vital signs every 15 minutes, and where you start to feel a sensation through your body come back, first in your toes and then through your legs. And you have the nurses come in, pushing on your uterus on the outside to make sure that you are contracting and bleeding as you should be. And they put these sexy little mesh panties on you with a huge granny pad, which helps because you are bleeding like a sieve. I'm sorry, TMI, but this is what it's like. You know, your first 24 hours, you are bleeding a lot. So my recommendation, do not bring any underwear from home that you do not want to ruin or stain. Wear their little mesh lingerie and their granny panties or their granny pads, and use it. And then after this, within probably 12 to 24 hours, depending on you or your circumstance, your health, your vitals, and everything else, they will then see if you're able to walk. Once you're able to stand up and walk, and they will remove the catheter. And at this time, this is just time for you to recover and to not, I want to say, walk in far distances, but at least get moving, get going, get things, blood flowing, obviously, and just, it makes you heal faster. And by this time, either A, you have your baby with you, or if other things are happening and your baby has to be in the nursery or the NICU, then that might be the case. But after that, it's pretty much just recovered for the mom, and you're in the hospital for about 3 days. When you come home, it's going to be a little hard to move around, but I promise you, usually after about the first week, it gets so much easier. So some pieces of advice to give to you moms who are going in for a cesarean section is, the first time you actually stand up to walk, it will feel like your stomach, your guts, your intestines, and everything that's in there is about to fall out. Some women experience it, some women don't. I won't say I didn't, but I kind of did. I promise you, nothing's gonna fall out. It's just that weird feeling, and you have your incision, and for each shift that the hospital is taking, that the nurses are coming on, you'll be having nurses come in and push on your belly, and it's not a comfortable feeling. It's very, I don't want to say very painful, but it's very uncomfortable. But this is their way just to, assess your uterus and making sure that it is going back down to size and contracting as it should be. Another piece of advice I have is for those moms who shame other moms. And I know this kind of doesn't really fit into this video, but it really does. People like to think or say that because you did not vaginally give birth, that it was unnatural, or it's not a natural birth, or you didn't give birth. No matter how your child came out, whether it be a planned or emergency C-section or vaginally, unmedicated or medicated, whatever happens, you grew a person in you. You grew a beautiful child, and they were born, and you created life. No matter how it came out, he or she, you gave birth, and it is a miracle of how it happens. So don't feel bad if your birth plan goes awry and you have to end up having a C-section, or you can't take the pain and you have to go with an epidural and you have it vaginally. Whatever way you have your child, they are born. It is a birth. So I don't like when other moms say, oh, you didn't really give birth, you had it easy. It's not easy. Maybe you don't experience pain during the actual birth process of it, but afterwards, honey, you experience pain. It is a surgery. You are sliced open and put back together. It hurts afterwards. It does. I'm not gonna lie. It does hurt, but it goes away. Personally, I feel that I would have rather given birth vaginally. It just wasn't in the cards for me. It wouldn't work. And my reasoning for doing a planned C-section this time around is because my daughter's weight was, you know, almost 9.5 pounds, and we want to avoid complications. I'm a type 1 diabetic. I'm very high risk. I don't want to be selfish and have a vaginal birth and risk my daughter's life and end up having a stillborn baby because I chose to have my birth the way I wanted it rather than having a birth that's safe for the baby. And I know I've gotten so much ridicule for why shouldn't I have a VBAC, I should just try. And I'm all for trying. If I go into labor and I'm able to push this baby out before my planned C-section, then so be it. But if it does not work and this baby is in distress, well then I want the doctors to get her out any way that they possibly can, which is safe for her and safe for me. So if you guys have any questions or any comments down below, please leave them. I hope you guys like this video. Do not be afraid of a C-section. It has its moments where you're going into this very cold room and there's a lot of people and it's just, you know, it's a little scary, to be honest. But you are in good hands and you are safe. And the worst part really is just pain management afterwards. But it does get better. And in the end, you have a beautiful, precious little baby to hold. So I guess just kind of look on that bright side of it. So I will see you guys for our next video. Bye. Normal weight for a baby at 32 weeks gestation is about 3-ish pounds, between 3 to 4 pounds. Baby girl weighs 6 pounds.